Okay, so gonorrhea is basically a sexually transmitted disease caused by an organism called Neisseria gonorrhea and is a gram-negative intracellular diplococcus. It's mostly an infection that infects the columnar, cuboidal, and transitional epithelium. The common sites of infection include mucosa of urethra, the pharynx, rectum, endocervix, and conjunctiva. The prevalence is less than 1% in women of childbearing age, which is usually between 15 to 45. A transmission is basically transmitted from one person to another through vaginal, oral, or anal sex. Women have a 60 to 80% risk of getting the infection from a single act of vaginal intercourse with an infected man. The signs and symptoms are usually asymptomatic in up to about 50% of females, as you can see over here. Other symptoms include low abdominal pain, pain arising from sexual intercourse, and also pharyngitis, which occurs through oral sex too. When symptomatic, the commonest presenting symptom is vaginal discharge, which is profuse, odorless, irritating, and whitish to yellow in color. Diagnosis: specimen for diagnosis is obtained from an endocervical swab, not high vaginal swab. Gram staining and microscopy of obtained specimen reveals gram-negative intracellular diplococci. And other methods of diagnosis include culture and polymerase chain reactions. Treatment: antibiotics are used. The antibiotics for treatment are mainly quinolones and cephalosporins. There's a profloxacin 500 milligrams orally, ceftriaxone 125 milligrams orally, or cefizime 400 milligrams orally, or as a single dose. And the sexual partner should also be treated for infection. The complications include pelvic inflammatory disease, tubo-ovarian abscess, tubal adhesions, infertility, ectopic pregnancy, and also chronic pain, chronic pelvic pain. So basically, prevention of abnormal vaginal discharge: you counsel the patient on personal hygiene, dressing, sexual activity, change of tampons and sanitary pads regularly, avoid douching, dry underwear in the sun, you wear cotton panties to avoid wearing tight underwear and clothes too. Use the barrier method of contraception often. Also, wash the vulva after intercourse, avoid wiping from back to front, and avoid alternate vaginal and anal sex.